Welcome to Shaw Spotlight. We're here at the Thunder Bay Regional Health Sciences Centre with Dr. Stu Kennedy, who is the COVID-19 Incident Manager for the Thunder Bay Regional Health Sciences Centre. First of all, Dr. Kennedy, can you explain to us what is COVID-19 and the coronavirus? Why are they called two different things?
So COVID-19 is one subtype of the coronavirus. There's 7 subtypes, and you'll notice in the past we had SARS was one, Middle Eastern was another one, and certainly that's the difference is it's one subtype. All these viruses originated from either mammals or birds, and then they cross-contaminated with humans, and that's why this virus is so sort of contagious and can be so deadly because of the genetic makeup of it, and we just haven't been able to catch up with proper sort of immunizations that we can actually help prevent it actually. But it's a very, very growing type of virus that we may get other ones as the decades expand.
So COVID-19, why it's so much worse than SARS or H1N1 or any of the other viruses that we've seen?
Again, we think it's came from. We don't know whether it came from the birds this time, but it cross-contaminated with humans. Probably originated in China. The reason we don't know why it's so much more contagious than the other COVID types of viruses. But I'll tell how bad it is with SARS, there's only 8,000 cases worldwide. At this point, high death rate in SARS, but with this virus, right now the count's growing. It's over 300,000 worldwide. So you can see the contagiousness of this virus is highly contagious, and it can really affect 35% of the population if we let it go throughout the population. And the reason it's so contagious is you have minimum symptoms. Okay, most of us could get a sore throat, okay, a bit of a cough, and you have the virus. The other reason it's so contagious is it can live in inanimate objects for 2 to 9 days. So you could just pick it up, and acquire it by a hand railing. Okay. So the key thing is you have to wash your hands. If you think you've washed your hands enough, do it again. So also cough or sneeze into your arm to make sure that is, and you need to practice physical distancing because you need that 6 meters apart to make sure that the droplet by droplet formation, you're not catching it, you're not spreading it. And if I can say anything to the public, you have to be responsible for not only your health, you have to be responsible for your children's health, your parents' health, and your healthkeeper's health. It's very contagious, and you can actually bring people down with you, and you're the only one to blame if you don't practice those health and safety protocols.
Will the virus stick to clothing? Will a mask help? I know those are a lot of questions that are being asked. Gloves?
The virus will stick to clothing, handrails, doorknobs, and it'll live there, I would say, for 2 to 9 days. And certainly that's why we advise everybody, especially in the healthcare field, to wear separate clothing to work, change at work before going home, as soon as they get home, shower, because you don't want to bring this virus back to your loved ones, which is very important because we got to keep you working and keep you healthy. Also, for anybody who's traveled, you really have to follow the guidelines, follow the protocols, because you're hurting not only yourself, you're hurting people around you. So if you've been traveling outside the country, if you've been traveling from the United States, self-isolate yourself for 2 full weeks and don't break those protocols because if something happens, this virus spreads into this community, you have yourself to blame. If your physician, your nurse, your housekeeper who's working in a hospital dies and you've broken these protocols, it's your fault.
Will a mask help you? I know you see a lot of people walking around, especially in the hospital right now, wearing masks. Will a mask help?
A mask will provide minimal help, and when I say that, it prevents you from touching your face. Okay, so that's important. And if somebody because it's a droplet, if somebody coughs and sneezes, on you, there may be some minimal protection. But the other protocols are more important. The distancing for the I said 6 meters. I meant 2 meters. The distancing from certainly the hand washing, coughing into your sleeve. And if you have symptoms, you make sure you call the public health department, get a screen, and if they think it's important or they think you meet the criteria, then you'll be sent to the assessment center for swabs.
So is it important if you think you have this to get tested so that you can keep track of it, or can you just stay home and hope you can beat it?
Yeah, absolutely not. It's not important to get tested. Right now, if you're living in Thunder Bay, you're living in Ontario, living in the world, assume you have the COVID-19 virus when you have a cold. Assume you have it, so you take all those precautions. 85% will get better on their own. There's no need to come to your primary care physician. There's no need to come to the emergency department just to diagnose it. You can fight this off yourself. If you have symptoms, which is a high fever, shortness of breath, cough, travel sort of history, then it is important to get screened. Our medical protocols are changing every day, so we may be into the community sometime in the future if we need to look at what the prevalence is in the community, but right now we need to preserve our swabs for the people who need it, and that's inpatients and people who meet the criteria for swabbing.
I know this is an obvious question, but I think it needs to be answered. If you do have COVID-19 and you're very sick, how do you treat it? Is there a treatment for it?
We have no medication right now to treat COVID-19, but we have a great group of health professionals, and we have a great group of technology that can help treat this. When I say treat this, I mean the main thing is respiratory symptoms and difficulty breathing and pneumonia in your lungs. So we have an ability to bring you into the hospital, give you oxygen, if required, give you ventilation, and your own immune system is one of the most important things. So we can sustain things for a period of time, but it also depends on the viral loads. Let me give you an example. If you're just walking along and you touch the virus and you touch your mouth, your viral load is small. If you're a physician, an anesthesiologist, or an emergency room doctor, or a nurse, and you're intubating somebody, that viral exposure when they cough or sneeze right on you is certainly a concern. So they have a higher risk because of the viral load they're getting. So most people can fight it off very well, but it's a heightened risk in healthcare facilities when that viral load is high, and that's why we have to wear protective equipment when we go through these high-risk procedures.
Now, I know everyone should be practicing social distancing and self-isolation when they need to. We don't want people to panic, though. We want them to be smart and stay calm. Is there a message that you want to send out to the community just about that?
Yeah, you're absolutely right. One of the messages I'm trying to give to the community is be safe, be kind, and be responsive to each other. Be responsible for your health care and the health care of your friends, health care of your neighbors, and health care of our healthcare workers who we need when you do get sick.
Hey, Dr. Kennedy, thank you so much for talking with us.
Thank you.